Welcome back to Health Decode, everyone. In the modern medical world, with its remarkable advancements, we often tend to place absolute trust in new pharmaceutical drugs and high-tech therapies. However, hidden deep within human history, a treasure trove of ancient medical knowledge, healing methods that have been proven over thousands of years. Today, we will together explore such a treasure: traditional fermentation therapy. Do you believe that natural fermented foods and beverages, prepared according to ancient recipes, have the powerful ability to heal your gut, even offering superior benefits compared to many modern treatments? It may sound extraordinary, but the truth might make you reconsider how we approach gut health. Let's join Health Decode in delving into the fascinating world of fermentation therapy and discover forgotten healing secrets, things that modern medicine may not have fully tapped into. Part 1. The rich history and global prevalence of fermentation therapy. The process of fermenting food and beverages is not a modern invention. In fact, it is one of the oldest food preservation methods known to humankind, dating back thousands of years and practiced in almost every culture around the world. From preservation needs to health benefits, in an era before refrigerators and modern preservation techniques, fermentation was an essential way to extend the shelf life of food and prevent the growth of harmful bacteria. However, ancient people, through experience and observation, gradually recognized the significant health benefits that fermented foods offered, especially for the digestive system. The diversity of fermented foods and beverages worldwide: Asia, kimchi Korea, miso and natto Japan, kombucha originating from Manchuria, pickled vegetables many countries, tempeh Indonesia, milk kefir, Caucasus region, Europe, sauerkraut Germany, milk kefir, and yogurt Balkan and Eastern Europe, sourdough bread many countries, cheese many countries, wine and beer with a long history, Africa, togwa South Africa, kisra Sudan, injera Ethiopia, Americas, tepache Mexico, chicha Andes. Cultural and culinary role. Fermented foods and beverages are not just part of the diet, but are also deeply intertwined with the culture and culinary traditions of many nations. They are often prepared according to family recipes and play an important role in daily meals, as well as special occasions. Decline in the industrial age, with the advent of modern preservation methods such as canning, freezing, and the use of chemical preservatives, the consumption of traditional fermented foods has somewhat declined in some parts of the world. However, in recent years, growing interest in gut health and the benefits of natural foods has sparked a strong resurgence of fermentation therapy. Part 2. The miraculous mechanisms of fermentation therapy for gut health. The gut healing power of fermented foods and beverages comes from several complex and coordinated mechanisms. Supplementing probiotics, live beneficial bacteria. The natural fermentation process produces a large number of live microorganisms with beneficial effects, also known as probiotics. When consumed, these beneficial bacteria can temporarily reside or even colonize the gut, helping to balance the microbiota, inhibit the growth of harmful bacteria, and improve digestive function. Natural prebiotics. Many foods before fermentation already contain prebiotics, soluble fiber, that beneficial bacteria can use as food. The fermentation process can increase the digestibility and absorption of these prebiotics, helping to nourish the existing beneficial bacteria in the gut, producing postbiotics beneficial metabolites. During fermentation, microorganisms produce many metabolites beneficial to health, known as postbiotics. These include short-chain fatty acids, SCFAs, such as butyrate, acetate, and propionate, vitamins, such as vitamin K, and some B vitamins, digestive enzymes, and natural antimicrobial compounds. Butyrate, for example, is an important energy source for gut cells, helps maintain a healthy mucosal barrier, and has anti-inflammatory effects, enhancing digestibility. The enzymes produced during fermentation help break down proteins, carbohydrates, and fats in food, making them easier to digest and absorb. This is particularly helpful for people with digestive issues or enzyme deficiencies. Reducing antinutrient content. The fermentation process can help reduce the levels of antinutrients present in some foods, such as phytate in legumes and grains, helping the body absorb minerals better. Improving the integrity of the gut mucosal barrier. The beneficial bacteria and postbiotics from fermented foods can help strengthen the gut mucosal barrier, reduce leaky gut, and prevent the entry of harmful substances into the bloodstream. Modulating the immune system. The microorganisms in fermented foods interact with the immune system in the gut, helping to train the immune system, enhance defense against pathogens, and regulate inflammatory responses. Impacting the gut-brain axis. The beneficial bacteria and metabolites from the fermentation process can affect the gut-brain axis through various mechanisms, influencing mood, behavior, and cognitive function. Part 3. Comparing traditional fermentation therapy with modern medicine in treating gut issues. To assess whether fermentation therapy is truly better than modern medicine in healing the gut, we need to consider several important aspects. Modern medical treatments often focus on symptom management, using drugs to relieve pain, reduce inflammation, and control diarrhea or constipation. Eliminating harmful bacteria, using antibiotics in cases of infection, suppressing the immune system, using corticosteroids or immunosuppressants in inflammatory bowel diseases, supplementing digestive enzymes in cases of enzyme deficiency, surgery in severe cases such as bowel obstruction or complications of inflammatory bowel disease. Advantages of traditional fermentation therapy. Holistic approach simultaneously affects multiple aspects of gut health, including the microbiota, mucosal barrier, immune system, and gut-brain axis. Natural and safe origin, when prepared correctly, generally causes fewer serious side effects compared to many pharmaceutical drugs. Low cost and accessibility. Many fermented foods can be prepared at home or purchased affordably. Long-term health support focuses on rebalancing the gut ecosystem and enhancing the body's self-healing abilities. Diverse benefits. In addition to gut health, fermented foods can offer many other benefits for overall health. Limitations of traditional fermentation therapy. Effectiveness may vary among individuals, depends on initial health status, individual microbiota, and usage. Unstable probiotic content. The number and types of microorganisms can vary depending on the preparation method and storage conditions. Takes time to see clear effects. Not a quick fix for acute problems. May not be strong enough for severe conditions. In severe illnesses, modern medicine with strong interventions may be necessary. Potential risks if prepared incorrectly. Can lead to food poisoning if hygiene is not maintained during fermentation. Differences in approach. Modern medicine often focuses on identifying and attacking specific pathogens, while fermentation therapy aims to create a healthy gut environment that helps the body self-regulate and fight disease. Part 4. Scientific evidence growing supporting the benefits of fermentation therapy. Although fermentation therapy has been used for thousands of years, modern scientific interest in this area has only truly exploded in recent decades. However, a growing body of research shows the potential benefits of fermented foods and beverages for gut health and the entire body. Research on probiotics. Thousands of studies have demonstrated the benefits of specific probiotic strains in improving symptoms of IBS, reducing antibiotic-associated diarrhea, boosting the immune system, and even improving mental health. Many fermented foods are natural sources of probiotics. Research on short-chain fatty acids, SCFAs, especially butyrate, produced during the fermentation of fiber by gut bacteria, have been shown to play a crucial role in maintaining a healthy gut barrier, reducing inflammation, and may protect against colorectal cancer. Research on the impact on the immune system. Some studies suggest that consuming fermented foods can enhance the production of IgA antibodies, boost the activity of immune cells, and help the body respond more effectively to pathogens. Research on the gut-brain axis, animal and human studies, indicate that probiotics and metabolites from fermentation can influence mood, anxiety, and cognitive function. Specific research on fermented foods, yogurt. Many studies have proven the benefits of yogurt containing live cultures for digestion and the immune system. Kimchi. Research suggests that kimchi may have anti-inflammatory, antioxidant, and cardiovascular health improving effects. Kefir. Proven to contain a large and diverse range of probiotic strains, beneficial for digestion and the immune system. Sauerkraut. A source of fiber, vitamin C, and probiotics, which can support gut health. Kombucha. Although more human research is needed, some initial studies suggest that kombucha may benefit the gut microbiota and liver function. Important note, while the initial evidence is very promising, it is important to emphasize that much research is still in its early stages, and more large-scale human clinical trials are needed to fully confirm the health benefits of each specific type of fermented food and compare their effectiveness with modern treatments in various disease conditions. Part 5. Safety factors and risks to consider when using fermentation therapy. Although generally considered safe for most people, there are some safety factors and risks to consider when using fermentation therapy. Risk of bacterial contamination if prepared incorrectly. Fermenting food at home requires caution and adherence to hygiene principles to avoid the growth of harmful bacteria. Die-off symptoms. When first starting to consume fermented foods, some people may experience temporary symptoms such as bloating, indigestion, or abdominal pain due to changes in the gut microbiota. These symptoms usually subside on their own after a few days or weeks. Histamine content. Some fermented foods can contain high levels of histamine, which may cause symptoms in people sensitive to histamine. Drug interactions. Probiotics in fermented foods may interact with certain medications, especially immunosuppressants, not suitable for some individuals. People with severely weakened immune systems should consult their doctor before consuming large amounts of fermented foods. Need to choose quality products. For commercial fermented products, it is necessary to choose products that contain live and active cultures and do not contain excessive sugar or additives. Part 6. Guidelines for using fermentation therapy effectively and safely. To maximize the benefits of fermentation therapy and minimize risks, you can refer to the following guidelines. Start slowly. If you are new to fermented foods, start with a small amount and gradually increase over time to allow your body to adapt. Diversify fermented foods. Consume a variety of different fermented foods, for example, yogurt, kimchi, kefir, sauerkraut, to provide a broad spectrum of probiotic strains. Choose naturally fermented foods. Prioritize naturally fermented products that do not contain added sugar or artificial preservatives. If making at home, adhere to strict hygiene principles. Use clean utensils, fresh ingredients, and follow reliable recipes. Listen to your body. Observe how your body reacts to each type of fermented food and adjust your consumption accordingly. Combine with a healthy diet. Fermentation therapy will be more effective when combined with a balanced diet rich in fiber and other natural foods. Consult professionals. If you have any health concerns or are taking medication, consult your doctor or a nutritionist before making significant dietary changes or starting fermentation therapy. Do not consider it the sole treatment for serious illnesses. Fermentation therapy can be a helpful addition to the treatment of gut problems, but should not completely replace proven medical treatments, especially in severe cases. Part 7 continuing. The harmonious combination of traditional and modern medicine. As scientists continue to delve deeper into the mechanisms of action and effectiveness of ancient healing methods like fermentation therapy, it will help us maximize their potential and integrate them appropriately into modern treatment protocols. Instead of viewing them as mutually exclusive options, we can find ways for them to complement and enhance each other's effectiveness. Modern medicine can learn from ancient wisdom. Thousands of years of using fermentation therapy have provided profound insights into its impact on gut health. Modern scientists can build upon these observations to design targeted research and explore specific mechanisms of action. Ancient therapies can be strengthened by scientific evidence. Modern scientific research can provide objective evidence of the effectiveness of fermentation therapy, helping us better understand its benefits and limitations in various health conditions. This can help standardize its use and provide evidence-based recommendations. An integrated healthcare model. The future of medicine may lie in the combination of modern treatments and traditional therapies proven to be safe and effective. In the field of gut health, this may include using pharmaceutical drugs to control acute symptoms, while incorporating fermentation therapy and lifestyle changes to support long-term gut health and prevent recurrence. Collaboration among experts. Collaboration among modern medical doctors, traditional medicine practitioners, scientists, and nutrition experts is essential to build a comprehensive and personalized approach to gut health. Part 8. Conclusion. Exploring the hidden healing power from the past. Traditional fermentation therapy is not just an ancient food preservation method, but also a treasure trove of potential medical knowledge. With its ability to impact the gut microbiota, mucosal barrier, immune system, and gut-brain axis in multiple ways, it offers significant benefits for gut health and the entire body. Although modern medicine has made remarkable progress, exploring and integrating ancient healing methods like fermentation therapy can offer a more holistic and natural approach to health. Instead of being in opposition, modern medicine and ancient wisdom can complement each other, providing optimal solutions for complex human health issues. Remember that caring for your gut health is an ongoing journey. Exploring and applying natural and traditional methods like fermentation therapy, combined with the guidance of healthcare professionals, can help you achieve a healthy digestive system, a strong body, and a clear mind. Healing power sometimes lies in the simple things that have been passed down through thousands of years. Open your heart to embrace and discover these treasures to enhance your quality of life. If you found this information helpful, don't forget to like this video and share it with your friends. And to not miss other valuable health insights from Health Decode, hit the subscribe button right now. Thank you for watching.